Welcome everyone to this session on primary care and quality of care of the European Training Network Improving Quality of Care in Europe. We're going to have 3 papers delivered. They are 3 works that touch on critical issues in primary care. The first one, presented by Jamie, looks at incentives and potential for unintended effects, eventually some gaming of payment mechanisms. The second paper looks on treatment adherence and is going to be presented by Anna. The third paper is going to be delivered by Joanna and looks on organizational forms that shape distinct incentives for primary care physicians. Although each paper uses data from a different country, we believe that the insights that we can obtain from the works can be of more general and wider interest. After all, in all the countries we face similar problems, and the structures of primary care, although different, are not that different in the sense that these problems will exist in one way or in another in the different countries. To comment on each of the 3 presentations, we're going to have 3 discussants from the Portuguese National Health Service. We wanted to have people that are involved in the day-to-day practice in primary care and in management that can look at the presentations and the papers and think how they contribute to their practice and also how they can inform future work from their experiences and from the relation to the works that have been done. So the discussants that were selected for this series were first, Bruno Heleno is going to be the first one to present his comments, who is a medical doctor, has a PhD as well, and works as a general practitioner and is associated with Nova Medical School. So he has a good knowledge of the academia rules, but is also a practicing physician in primary care. The second discussant is going to be Alexandre Lourenço. Alexandre is the current president of the Portuguese Association of Hospital Managers. He has worked also as consultant for primary care reforms in several European countries under WHO head. He also is a current manager in a large teaching hospital in Portugal, located in Coimbra. He was formerly member of the board of ACSS, the financing body of the Portuguese National Health Service. And finally, we have another general practitioner to make comments, Daniel Pinto, who also has a PhD and is also associated with Nova Medical School. And so he brings also a view of the practice to this discussion. They will assess the results obtained. They help us think how they can help change and hopefully improve the practices of primary care. And they will bring also insights from that practice. What elements that were present in the papers that gathered their attention, and which elements could eventually be added to make the papers even more relevant, or which research questions did these papers raise in their minds so that we can further explore and further contribute to improving quality of care in Europe. And so this balance between taking the results from research and bringing them to people that do practice that are in the real decision-making process of treating patients, and then go back with the elements and the ideas that we eventually left out of the models that are relevant to include in the future, or new questions that were raised because we have produced these results so far, is an interesting process. I hope this will result in a balanced discussion that everyone will enjoy it, and it will highlight how academic research can bridge to the real practice in a useful way, and how actually practice can also inform new ideas for research that improves the quality of care in Europe, which is essentially the topic of our European Training Network.